I wanted the hard work that Sam had put into developing the community mental health team to be appreciated. The reason they are performing the way they are and have made so many changes over the past few years is because of Sam's ability as a team leader and her commitment and enthusiasm. I would describe Sam as being very committed, very enthusiastic and very conscientious. And perhaps her biggest skills are her communication and organisation skills, which has allowed her to get the whole team behind her and all moving in the same direction.
What makes a good team leader in Dorset HealthCare? Supporting your team to do their job and to do it well, to make sure systems are in place for them to do their job and do it well, and ensuring that they appreciate the good times and the bad times, because sometimes the job can be tough. To my nominator, Tony Deven, I'd like to say thank you. I'm humbled and I appreciate the nomination. Win or no win, I appreciate the nomination. It makes you think that actually, yeah, I'm doing a good job.
I nominated Antonia because staff of her level don't normally get the recognition that they deserve. Antonia's so good at her job because she has an open door policy for all staff. She would never ask them to do anything she wouldn't be willing to do herself. And she allows staff to use their own initiative and progress in their careers. I'd like to say to Antonia, have faith in yourself. You're doing a really good job.
A good leader is about starting with yourself, and it's about how you behave, how you act, and how you promote your organisation. It's about inspiring a shared purpose in others and having a desire to achieve the best you can. Just like to say thank you, Laura. I think it's brave of you to nominate a manager, and I just really appreciate it.
Hayley's worthy of this nomination because she was such a good manager when she was acting sister. She was very kind, very considerate to obviously all the patients, but definitely towards all the staff as well. And she really encouraged team morale at a time where we were quite low in morale, and she benefited the whole team by being there and listening to people. If Hayley was here today, I would say to her that I think she's a wonderful person, that she really stepped up very well into a role that was something completely different to what she already did, because when you're a staff nurse you treat patients but you don't have to manage a team, and she was very good at managing a team, and she should think about that for her future.
I think I took the job extremely seriously. I knew there were going to be challenges, but I tried to rise up with those. I think you need to have good leadership skills. You need to be approachable. That was one of the main things I found. You know, the staff, everybody needs to be able to come to you. You need to make sure that you've always got time for your staff and your patients. Never turn anybody away. If there's a time when somebody really needs to speak to you, you take that time out to speak to them then and there. I think the team are fantastic. We've got lots of very experienced nurses and healthcare assistants, and I couldn't have done the job that I did so well if it wasn't for the team and the support I had from the team.